helping you find your new way forward to the best years of your life. This is a New Way Forward podcast with your host, Paul Long.
I want to die young at an old age, and I'm on my way to doing that. And how I did it, well, lots of ways. I'm going to share some of those with you in this video, but the most critical thing of all was to discover the truth about healthy aging, to, quite frankly, destroy the myths that we all believe that ultimately lead to our decline. These things that we buy into as truths that are false, and the opposite of it, which I'll share with you here, and when I myth bust all these, can lead to a healthy, active, relevant, purposeful, joyous, longer, not lifespan, but health span. But here's the interesting thing, that in the United States and many Western cultures, when you look at the primary causes of death, most of them are preventable and or self-inflicted. We're being comfortable to death in terms of the food that we eat and the lack of activity that we have, and so on and so forth. So with these myth busters, these 7 myths that I'm going to destroy, I'm really giving you the path to, quite frankly, living like me and so many people now, where we're healthy and active and relevant. And the power lies with you. And other than some medical conditions and things like that, pretty much only you. All right, number 1, there's little I can do about my decline. Balderdash. That is ridiculous. Okay, first of all, let's talk about longevity and lifespan. Ignore lifespan. Lifespan, in the first place, when they come up with those statistics, oh my gosh, it was 78.7, now it's 78.2 or whatever. First of all, you got to realize that that's a very complicated formula that involves even infant mortality and such. And the biggest thing is it's not you. It's not me. And there are some things that are, by their nature, may be out of your control, such as an accident or a gun death. But what is in your control is that when you do look at, in the United States and many Western countries, the top causes of death, heart disease, cancer, things of that sort, they're almost all self-inflicted and or preventable. We're being comfortable to death. These are things that, based on what we eat and what we don't eat, and getting exercise, both aerobic and resistance training, because, by the way, our lack of moving our butts, being sedate, is now being termed the new smoking, because it is hugely, catastrophically harmful to your overall health. So the fact that there's very little that we can do with our decline is balderdash. I believe that most people become old, the stereotype of old, because they think they're supposed to. 10 years ago, people would have considered me old. 20 years ago, people might have considered me old. And then I realized that I'm healthier, more energetic, more vibrant, more excited about what I'm doing and my future than I was back then. I'm healthier because 15 years ago, I was in bad health. And when I started trying to figure out my new way forward, what am I going to do in olderhood? I said, well, the very first thing you got to do is you got to improve your health, because you're not going to have the health and the energy and the vitality to figure it out and go after it and then enjoy it. I got into it because I've spent 15 years researching this stuff and researching it from legitimate sources, I've got a core of people like Dr. David Sinclair, Dr. Rhonda Patrick, Dr. Peter Attia, and Scott Fulton, who's a data scientist and got into this kind of thing. And he's one of the poster boys, by the way, for great health. I'll be talking about his book in a second. That was really looking at how we can mitigate, slow down, and in some specific things, actually reverse our aging. You could say legitimately that I reversed my aging. I was older 10 years ago than I am now in terms of my biohealth and my vitality. In all these intervening years, I have rarely been to the doctor. All right, number 2. Well, I don't really want to live a long time because toward the end, it's really going to suck. Well, it doesn't have to. I mentioned that my goal is to die young at an old age. So there was a friend of mine who is a financial advisor, a retirement advisor. And he was sitting down with a husband and wife clients, and he was saying, okay, what we need to do is kind of map out the financial situation all the way to your age of 95. And the guy said, whoa, I don't want to live to 95. Oh my gosh, if I make it to 85, I'm going to be like, take me, please. That's assuming that by 85, I'm going to be feeble and decrepit and sick and in misery. And yeah, there's certainly an argument that extending someone's life when they're not able to live, I'm just going to say, leaves a lot to be desired. But what if you were able to have the scenario that I gave earlier that's my intention? To live healthy, relevant until the day that I do die at an advanced age. And we got away from the basics of what makes us healthy. So when you look at our current lifestyle, it's really only been around for, I'm going to be generous here and say, a century. Clean food, medications, advancements in technology, and medical treatment. But when I say clean foods, that's something of a misnomer, because now we're eating all this processed food. We're eating all of this fat. We're eating all of this sugar. The big food companies are feeding our palate and our need for comfort food and things of that sort, and that's killing us. But we got away from the way that we as human beings evolved over hundreds of thousands of years, even longer than that if you believe in evolution and what led to Homo sapiens. Every creature on Earth, from a bacterium to you and me, was fundamentally created to do two things: to survive and to procreate. And over time, it's been adapting to environments. Well, when in not ancient times, but primeval times, look at the lifestyle that human beings led. It was feast or famine. Well, what's big now? Fasting, intermittent fasting. I do it because when you intermittent fast, the body optimizes itself. Whoa, we got a famine coming on here. So we really need to empower the body and clean it up. Clean it up literally by getting rid of dead or underactive cells, other things, to optimize ourselves. Or this, what we now call exercise, but physical stress, both aerobic and resistance training. Ooh, we're going to have to exert ourselves. We have to optimize the body in everything, our physiology down to our cells and our DNA and our proteins and our brain and everything else. Hot and cold environments, saunas and cold soaks are extremely healthy. Why? Because it triggers the body to optimize itself. I could go on and on and on. Those are the foundations. To change our DNA based on environmental conditions or living conditions takes 75,000 years. Well, we've had this new lifestyle for about 100 years. And our bodies are like, what the hell are you doing to me? Where's the exercise? Where's the good nutrition that I need? You see my point? And so when we revert back to those things in terms of our diet and in terms of exercise and in terms of sleep and in terms of purpose and all that kind of stuff that we were wired for, that's when our health gets better. All right, number 3, it's all about my genes. There's nothing I can do about it. Not true, except in a few cases. So get a load of this. I mean, you've heard the excuse before. I'm overweight, I'm this, I'm that, because my mother was, my father was, my father's family was. Here's the thing. Current research, and there's been a number of studies done on this that are basically right around the number that I'm going to tell you. The percentage of age-related illnesses and mortality, only 25% of those are related to your genes, to your DNA, that they're the cause or the enhancer or the mitigator of it. That means that 75% of those people who are suffering from age-related diseases will have been self-inflicted or environmental. Granted, if you live in an unhealthy place or can't get healthy food. So think about that. What I said earlier too, that most of the causes of death in many Western societies now are self-inflicted. So the fact that it's my genes that does it is more often than not the case. Great story about a cardiologist who kept trying to, I think he hit like his late 40s or something, and he was overweight and he was pre-diabetic, and he was running a lot, but he just couldn't lose weight. He just couldn't get into good health. And so he started wondering, and he's a doctor, why? What's my problem? At the same time, he was also wondering why do I have so many heart bypass patients? They're coming back for a second operation. And that's when he learned so many of these things that I'm sharing with you, because some of these things I learned from him. That it's about the proper diet, about proper exercise and other things. He had attributed being stuck the way that he was because he's like, well, I'm like my father. My father's the same thing, so it's his genes. No, he inherited his father's habits, as many of us do, as we're growing up in children, what we eat and everything. And he proved this because when he changed his diet, when he started exercising and doing all these other things I'm talking about, his health became amazing, and he lost weight, and he's maintaining his weight. He looks great. He's over 70 years old, and he doesn't look it or act it. And his father did too. Number 4, 10,000 steps does the trick. Yeah, all you have to do is just get up and move your body, and there you go. No. Now, look, first of all, I want to say that anything anyone does to move their butt, especially as they get older, I applaud. Good for you. If it's a stroll around the block, if it's housework, if it's yard work, if it's anything, I do applaud that. But I got to destroy the myth that that's enough. Because if you truly do want to extend that health span, you have to move toward vigorous exercise. That's just the way that it is. So certainly if you're not good in shape and you haven't been doing it, evolve. Do talk to your physician. With all of this stuff that I'm talking about, talk to your healthcare provider about it. I'm not just doing that to keep from getting sued. We all have issues and everything, and you need somebody to make recommendations of what to do and what to not do. But ultimately, the point I'm making here is that you want to build your way up. You want your goal to be vigorous exercise. When you get to vigorous exercise, that thing I talked about with our evolution, when you are pushing yourself and going higher and higher and higher, like each time you do something, you try to do it a little bit more. That's when the body really starts optimizing itself. That's when it starts having an impact on it. And so all of that kind of leads into my next myth buster, which is number 5, getting healthy is really hard. You've maybe heard me talk about choose your hard. that, changing your life is hard. Getting out of financial trouble is hard. Getting healthy is hard. But it's harder to not change your life and live a life that isn't fulfilling and good for you. It's harder to deal with being in financial trouble, and it's harder to be in bad health. So the point of this is, either way, it's going to be hard. So choose the hard that gives you a return on investment. Choose the hard that's going to make life better for you. And that's when it comes to getting healthy in terms of nutrition and exercise and good sleep and community and things of that sort. The good community is not as hard. That's pretty damn enjoyable, right? So when I had to turn myself around 15 years or so ago when I was in bad health, I came up with this idea, and boy, did it work. And I've shared it with other people, and they're like, oh, boy, did that work. What I did is that every morning when I woke up, I decided on one little healthy thing I could do that day that I didn't usually do. And so it might have been something about what I'd eat or what I wouldn't eat, or a physical activity or whatever. Just one little thing every single day. And after a few days, it became a habit, and I started doing it. And then what I discovered was that, after a few weeks, some of those little things I was still doing. So I was building these healthier habits. What I was doing is I was taking 10,000 baby steps to better health. And so some of those things I did in those first couple of weeks, I still do today. And what happens with a baby? Because this totally aligns, this is totally accurate. What happens with a baby? They take those few steps, and then they start, kind of walking, and then they really walk, and then they start running and jumping and riding bicycles and everything else. It just grows and grows and grows. Because after a while, I started noticing the benefits of it. I started feeling better. I started feeling better about myself. So you can take these little steps, because the last but not least, which has led to me being able to make this video, was because I got into it, I started doing my homework. I started really thinking about, okay, well, what about this? What about that? And so, as I've been doing every morning for even longer than the 15 years, meditation and yoga in the morning. And when I'm doing the yoga, I'm usually got somebody on some topic, but a lot of times it's health topic, this core of people that I listen to learn, because I want to learn, and I want to learn new exercises and things of that sort. So you can take baby steps that eventually turn into leaps and bounds. Okay, next up, a healthy diet is a drag. Here are a couple of, I think, really good ways, some tricks that I have for you to approach this. The bottom line is, you know what foods are good for you, and you know what foods aren't. So those that aren't, you don't eat, or you hardly eat any. And those foods that are good, eat as much as you want of them. And avoid processed foods as much as possible, because we know that so many of the ingredients that are put in them are extremely unhealthy. There are ingredients in foods in the United States that are outlawed in the rest of the world. So you avoid that. Now, here are a couple of the tricks. Number one, when I improved my diet, I did not try to be perfect. I knew I would completely fail at it if I totally avoided this and stuff like that. No, I want a steak sometimes. I want ice cream, even though it's super bad for you, and not just because of the sugar, but the additives in it and things of that sort. I give myself a break. It seems like about every 3 months, I want a piece of chocolate cake, or I want to have a peanut butter and jelly sandwich and a glass of chocolate milk. I do it because overwhelmingly I'm doing it well. Now, here is the really great trick. The way to stop eating that stuff and eat more of this stuff is at the grocery store. It's what you buy and what you don't buy. If you pick up those Hostess Twinkies, you're going to eat them. If you don't, and it's 10 o'clock at night, odds are you're not going to drive down to the convenience store to get them. So it really starts with your menu. What stuff do you want to eat? What kinds of things have you discovered that you like that are healthy? And that's what goes on your shopping list. And when you're at the grocery store, you buy the good stuff and you don't buy the bad stuff. Okay, number 7. There's always modern medicine to bail me out. Oh my gosh, whatever you do, don't count on that. I want to say, thank goodness for modern day medicine and the treatments and the pharmaceuticals and things of that sort that are there if we need them. But the trick is to not need them. The trick is to have this healthy lifestyle so that you don't need to be on the drugs. Have you seen all of the consequences of those drugs, or just suffer through it all? So the key to doing that is what I've been talking about, and I want to try something with you that I've tried with a lot of people. I'm going to say a word, and I want you to note what you visualize the moment I say it. Okay, here we go. Healthcare. Healthcare. Now, every single time I've done that, I've heard doctors, nurses, pharmaceuticals, examining rooms, hospitals, and the like. Where were you? Where were you when it came to healthcare? Healthcare begins and ends with each of us. It begins with each of us, with everything I've been talking about in this video, of us taking responsibility for our own health. If you don't do it, nobody else is. In the United States and so many countries, most countries, healthcare is a misnomer when it comes to the industry. It's not healthcare, it's sick care. And especially in the United States, it makes sense because nobody's going to make any money if you're healthy. They make money if you're sick. And you've got to buy my drugs or my procedures or come into my office or whatever. And I don't want to disparage a lot of people in the healthcare industry who are caring. My doctor is one of the most caring people that I know. And I know people who have left clinical medicine because they can't practice it, because, oh, I can only see you for 10 minutes, even though I need to give you 20 minutes. So it starts with us in doing all the things that I've been talking about to avoid doctors in the first place. But the second thing too is who is your doctor? Now, I believe in lifestyle medicine doctors. Now, these are full-fledged MDs that then get certified in lifestyle medicines, meaning they're looking for these healthy ways of living and eating and things of that sort to either avoid them. My doctor says, I want to be put out of business because my patients don't need me. That's not going to happen. And also, are there treatment approaches to conditions that can be largely done, if not entirely done, by lifestyle choices? And the last thing too is that with that doctor, it's looking at it as a collaborative experience. I talked with my friend Scott Fulton, who wrote Wealth Span. And by the way, I want to slip in here that I love an acronym that he came up with, which is MEDAC, which stands for Mind, Environment, Diet, Activity, and Community. I'll say that again. Those are the keys to avoiding a doctor and health care, sick care, is mind, environment, diet, activity, and community. But we were talking about, our doctors really collaborate with us because we allow them to, and also those doctors know that we're taking our health seriously. I've got to believe that in most cases, doctors are going to put in a little bit of extra effort for those patients who they see are taking their health seriously. And I also want to say it ends because sometimes you cannot just take at face value what a doctor or a healthcare provider says that you should do. You need to challenge it. You need to think it through. You need to do the homework in the first place. So those are the myths. And if you think about it, these are false assumptions and presumptions and stereotypes we have about health and healthcare and such that can be fatal, and they can certainly diminish your life. But when you take control, when you take your 10,000 baby steps, when you're aware and you realize these things, you can join me in the aspiration to die young at an old age.
Learn more ways to enhance your life and discover a new way forward that's perfect for you by watching these videos or any others on my channel. Oh, and be sure to subscribe.